We are all interested in global health out of the desire to help people around the world. My goal this morning is to help us reflect upon the ways we can know when we are doing things right in the most impactful and sustainable way. This photo is an all too familiar image. These are women and children fleeing the violence in Syria. This just represents 10% of the 100 million people affected by humanitarian emergencies around the world. War, natural disasters, and infectious disease outbreaks affect these individuals. My passion in global health is to think about how we can address these humanitarian emergencies. This is absolutely crucial if we are going to achieve the Sustainable Development Goals and the achievements for Global Health 2035. This is because humanitarian emergencies represent the final holdouts for many infectious diseases nearly eradicated. In Nigeria, we're seeing increased outbreak of polio as a result of Boko Haram. We also remember the 10,000 lives lost as a result of the humanitarian emergency with the cholera outbreak following the earthquake in Haiti. And this is a powerful reminder of the 12,000 lives lost in West Africa as a result of the Ebola outbreak. Much of this could have been prevented if the health infrastructure had not been destroyed from 14 years of civil war. These represent just the infectious disease consequences. Think about the impact on maternal and child health, on non-communicable diseases, and also on mental health. As a psychiatrist and anthropologist, I've spent 2 decades working in humanitarian emergencies. I firmly believe that the only way we will best address health in these settings is through the marriage of service and science. Too many times I have seen people throw evidence-based research out the window in the name of expediency. Oh, it's an emergency, we just have to get this done. This leads to inefficient use of resources and can also lead to damaging interventions. I'm going to share with you today 3 stories about the integration of service and science. This is Kamala. I first met her in 2007, after a decade-long Maoist civil war in Nepal. As a former child soldier who had joined the Maoists at age 13, she was now going back to her community. At the time, I'd started working with Transcultural Psychosocial Organization, or TPO Nepal, with my colleague Suraj Korala, who is here with us today. We had been asked by UNICEF to design and implement religious healing rituals, which in Sierra Leone and Uganda had anecdotally been helpful to support the integration of former child soldiers. We asked UNICEF, first, let us do some research. For the best possible service, we need to do good science first. So we went and we spoke to Kamala. We asked her about this idea of religious rituals. She said to us, yes, it is very hard now back in my community. My family won't go out in public with me. I can't go into the school. And yes, rituals would be helpful. They would help me to be accepted by my family. They would help me get a man to marry. And there is no way that I will do those. She said to us, I joined the Maoists because they value gender equality. I did this to escape a child marriage. If I do your rituals, it's basically saying, ask me for forgiveness for the damage I've done to the karma of the men in my life, my father, my future husband, my future children. That goes against everything that I believe in. So Suraj and I worked with UNICEF to instead design interventions focused on formal education and civic engagement. Prior to our intervention, 2 out of every 3 girl soldiers had PTSD. 1 year later, it was 1 out of 7. Kamala returned to school, and she started a nonviolent youth political organization. This is just one example why good science is crucial to good service. This is a powerful image from the earthquakes that hit Nepal last year. My second example is that service opportunities are also ideal for generating new ideas in science. I've heard people say, humanitarian emergencies are messy. First, we need to try this under normal circumstances to demonstrate that it works. For far too many people around the world, humanitarian emergencies are the normal circumstances. And because of that, we can't neglect research in these contexts. Immediately after the earthquake that killed 10,000 people, displaced 500,000, we decided we needed to review the existing literature and figure out how best to help individuals and also generate important, novel research questions that had not yet been addressed. With many of my colleagues here in the room, we conducted a systematic review with the World Health Organization to inform humanitarian programs, and we generated new research questions. This is Sanku, a community where 104 people, many women and children, died on the day of the earthquake. We had found that kids returning to school had PTSD, depression, and even suicidal thoughts. So this was an ideal opportunity to work with the Duke Global Health students to design a school-based intervention to help prevent suicide. And 2 of the students in the audience today conducted a controlled trial of this intervention this past summer. Duke students are incredibly passionate about changing the world. Passion without critical thinking, though, can be a very dangerous thing. So my goal is to help students design important research questions, service-based research questions, but also continually engage in critical thinking in that process. I want to leave you with a third idea about integrating service and science, and that is using science to understand the impact of services and the health benefit of actually engaging in service behavior. This young man with the Dave Bautista wrestling shirt is Ramesh, also a former child soldier. We asked Ramesh, how would you know if our interventions were helping you recover after your child soldier experience? I had expected him to say, oh, my nightmares stop, my flashbacks are over. But Ramesh said to me 3 things. I will know your intervention has been helpful if I see in myself and other former child soldiers a desire to help the people around us. If I see that we actually have opportunities to help the people around us. And if they demonstrate equity, that we do not discriminate based on caste, based on ethnicity when we engage in that help. That will tell me that your intervention has been helpful. For Ramesh, the worst possible outcome of trauma was giving up on other people. Increasingly, we are finding science that supports Ramesh's attitude. Working with Steve Cole, an immunologist and psychologist from UCLA, we are studying how compassion, how helping others actually has impacts on the body. Steve has found that by engaging in compassionate activities, there's increased gene activation to fight against viruses and to reduce inflammation. And this has a whole host of impacts across the body, ultimately leading to reduced risk for cancer, heart disease, metabolic disorders, and mental illnesses. This summer, we published a paper in the Proceedings of the National Academy of Sciences demonstrating this also happens in child soldiers. Child soldiers with the highest levels of resilience, those saying that I can impact my life and impact the lives of others, were most likely to have low gene activation for inflammation and high gene activation to fight off viruses, boding well for their future mental health. This changes how I think about humanitarian interventions. We need to move from thinking that our role as health workers is to come in, address the physical health, address the mental health, and then let people go about their lives. Helping people to engage in helping others in development work in and of itself is going to have positive health consequences. I am delighted to be working at DGHI and very excited for the next 10 years. We have great examples of integrating science and service, whether it be in South Africa, Uganda, Guatemala, and Peru. If you are already integrating science and service in your work, I ask that you share your lessons with those around you to strengthen this practice at DGHI and in global health generally. If you are not yet integrating science and service, I ask that you talk to our partners from around the world and find new ways to do this. And I hope that all of you can leave today and remember the words of Ramesh that will guide us in our global health work. We will know we are doing things right at Duke and in global health if we see in ourselves and our colleagues the desire to help those around us. If we see in ourselves, our colleagues, our students, the opportunities to transform that desire into action in an evidence-based way. And we are valuing equity, so that in our work, we are assuring that people around the world have equal access to help and equal access to helping others.